Can a protruding disc be fixed, and what problems is it going to cause? So a lot of people need to hear this response, so please listen to the whole video so I can properly explain it. Yes, the simple answer is a protruding disc can be fixed. If you picture a disc like a balloon filled with sand, when you put pressure on one side of the balloon, you're going to move the sand to the other side of the balloon, distend the balloon, but the sand is going to stay in the balloon. Now this distended balloon gets in the way of the joint capsule puts pressure on the nerves, and it causes a lot of pain. Now the pain and symptoms that it causes can be very variable, because if it's putting more pressure on the joint, if it's putting more pressure on the capsule, if it's putting more pressure on the nerve. If it's putting pressure on the nerve, wherever this nerve goes throughout your body, it can actually have symptoms there, and this can be a very global, large aspect of your body. But here's a caveat. It's that most people, by the time you're 50, you're about 100% likely to have findings on your image without any symptoms whatsoever. And these findings would be a protruded disc, a herniated disc, degenerative disc disease, spondylolisthesis, spinal stenosis, and so many more. So the ultimate point here is be very, very careful about going off of imaging. From my experience, imaging is more misleading and inaccurate than most people realize. And the response to that is always, well, then what should I do? Well, what you should do is you should go to somebody that's going to listen to you, your symptoms, how they present, when they present, where they are, how they behave. And then they're going to look at your movement and see what symptoms you have with your movement or what limitations you have with your movement. And then finally, they're going to apply some version of treatment, and they're going to see what that treatment does to your symptoms. That is the treatment you should be getting in the medical field, but you're very often not. They're relying heavily on your imaging, and then they're relying heavy on medication to treat your symptoms. So the short answer is yes, disc issues can very often be resolved without any type of medication intervention such as surgery or injections, but it rarely is treated that way.